David Skriloff, Some Eating Disorders That You Should Know Of. An eating disorder is a mental and physical disorder that creates damaging, unhealthy, and complicated relationships with exercise, eating, the image of the body, and food. Around 10 million males and 20 million females suffer from these disorders in the United States. This illness is found in people of varying ages, socioeconomic status, ethnicity, religion, gender, etc. Types of eating disorders according to David Skriloff. According to David Skriloff, the different types of eating disorders have completely different symptoms and criteria for diagnosis. Here are some eating disorders. Anorexia nervosa. This is one of the most commonly known eating disorders. This disorder usually begins during the young adulthood period and affects women more. In this disorder, people tend to see themselves as having excessive weight even though their weights are dangerously low. According to David Skriloff, people suffering from anorexia nervosa become habitual in vigilantly monitoring their weight, restricting their calories, and avoid eating many kinds of food. Some symptoms of anorexia nervosa according to David Skriloff. They have quite restrictive eating habits. They consistently try to attain a dangerous level of thinness rather than focusing on a healthy body. They are always scared of gaining weight. Their body weight has a serious impact on their self-esteem. They are in denial about being underweight. Binge eating disorder. This is one of the most commonly occurring chronic illnesses in young adults. It usually starts during early adulthood. However, it can be developed later on as well. In this disorder, people tend to eat an unusually massive amount of food in one sitting. They do not have any control over themselves when they are binging. Some symptoms of binge eating disorder according to David Skriloff. Eating a lot of food. They often eat this food in secret until they are uncomfortably full. They eat even when they are not hungry. They do not have control over their binge eating. They feel shame, guilt, disgust, and distress when they think about their binging behavior. Bulimia nervosa. Bulimia nervosa most commonly occurs in men rather than women. In this eating disorder, people tend to eat unusually large amounts of food till they are uncomfortably full. The person would not be able to stop eating, no matter how much they try. This is just like binge eating disorder, except that in bulimia nervosa, people tend to attempt purging behaviors as compensation for the excessive calories that they consume. Some common purging behaviors include things like fasting, diuretics, laxatives, excessive exercise, and forced vomiting, says David Skriloff. Some symptoms of bulimia nervosa according to David Skriloff. They have recurrent episodes of binge eating. They take on purging behaviors to shake off the extra weight. They are very influenced by the weight and shape of the body. They are scared of gaining weight. They may be suffering from swollen salivary glands, sore or inflamed throat, tooth enamel that is worn, decay in the tooth, etc., due to their purging habits. Conclusion. David Skriloff discussed 3 types of eating disorders and their symptoms above. If you feel like you have any one of these 3 eating disorders, you should get them checked out by a healthcare professional. Thanks for watching.